Hi everybody, Dr. Kaylee Garrett Zimmerman here, founder and owner of FEM Empowerment and Advocacy. Today we are talking about part 4 of the low back pain series. So part 1 was about the anatomy and what it looks like, what you're looking at. Part 2 is kind of how to assess for it. What are you feeling? Where is it? And how do you know what it is? And part 3 is the two most important or the most significant, not significant, but the most common diagnoses that I see in the clinic, and it's either muscle or disc, and we talked about that in part 3. In part 4, I'm going to give you just a couple of tips for each of those on kind of what you can do as far as decreasing that discomfort. So if you go back to part 3 and you find that you are in the muscle strain or the muscle pain dysfunction type column, and you note that it's painful to touch, it's painful to move certain ways, it's not shooting down the leg though, it's not shooting up the back, it's more kind of just that one general area. First and foremost, you need to rest the muscle. You do have to move, but it's in moderation, but you do want to rest as well. There's such thing as moving too much and there's such thing as not moving enough. But when you're injured, you want to pay attention to that scale a lot more often. The next thing that I recommend is that you walk as much as you can, up to 30 minutes a day. If you need to, if it's pretty painful, you want to make sure that you do about 10-minute bouts. If you can't tolerate 10 minutes, drop it down to 5 minutes a day to get up to that 30 minutes. When you're walking, make sure you're not walking here. Make sure you have good posture, tailbone tucked, arms back, obviously not forcing it, but trying to make sure you're standing upright if you can. If you start to fall forward, you're going to make it worse later on, and it will come back a lot quicker. So that's step 1 of learning to recover from low back pain when it's a muscle dysfunction. Step 2 that you want to consider is going to be stretching, but movement. So let's talk about movement first. Movement is, and I mentioned this a little bit in the last video, when you have muscle pain or muscle discomfort and you go in one direction and that causes pain, I want you to start in the direction that does not cause pain. So let's say this direction causes a lot of pain. So you're going to first work on just moving down and rolling back up all the way. You're going to do maybe 3, 4, 5 of these only to where you can have pain free. So if it's painful here, stop, come back up. Painful here, stop, come back up. And then you're going to notice that you're going to eventually start to go lower and lower and lower. So you will ultimately gain range. Once you do about 5 of those, you're going to start to go in the other direction very gently, and you're going to do those. And you're going to do about 10 a day, so 2 sets of 5 a day. It's just going to get you moving. I don't want it to be fast, but you don't want it to be so slow either. And that's just going to get you moving and get those muscles loosened up a little bit. Same thing goes for side bending. If this side hurts, you're going to go this way, and then you're going to come back. Pain-free. You're going to do about, 3 to 5, depending on what you're tolerating, if it's a lot of pain or not, and then you're going to go in that other direction. And then you're going to start to notice, 1, pain's going to decrease, but you're also going to get more motion. The next thing that you want to consider is stretching. I'm going to show you on 2 stretches for each dysfunction or each diagnosis that I gave you before, so muscular or disc. The first stretch for muscle is going to be to stretch the front of your hip. The easiest way to do this, there's tons of ways to do this, but I find that the most tolerable for my patients is to lay flat on your back, especially if you have pelvic pain or especially if you have pelvic floor dysfunction. Lying flat on your back is very important. So if you're able to lay down, and then you're going to drop one leg off of the side of the bed very slowly, and you should start to feel a stretch. If you don't, you can wrap a hook around your foot and bend that knee up towards you, and you'll start to feel that stretch through there. You're going to hold that about 30 seconds, and you're going to do 3 on each side. I said 4, but 3. 3 on each side, and make sure you do both sides. It's important. If it starts to hurt the low back, come out of it sooner, but make sure you complete the stretch the best you can. Because what you don't want is to be so tight that you start to arch this way. So stop where it's painful. If you need to, stick a towel roll under the leg or lean it up against or have somebody hold it. If you start to go and it's still arching that pelvis, you're going to start to cause more back pain. So try to keep your spine flat. The next one, you're going to grab behind the knee and you're going to bring it up towards you. If that feels good or you don't feel a stretch, straighten that other leg out. If you're still not feeling a whole lot, bring both knees to chest, and you can do knees to chest stretch, or even open them a little bit and do a little bit more of a happy baby stretch. That's just going to help to loosen the bottom of the back all the way through the hips. So that's one of the most important ones for that. Well, two good ones for your muscle dysfunction pain. Now moving on to the disc. The disc pain is a little more prominent, so you know exactly what it is. If it's starting to shoot down your leg or it's shooting up into the back, you feel sharp, numbness, tingling, any of those symptoms, first and foremost, be very cautious. Try not to bend forward a whole lot. That's just gonna put this and give it more room to kind of get hurt or allow more room for it to swell more. You want to stand up right. You want to be as tall and pay attention to your posture as much as you can. Again, you want to walk up to 30 minutes a day, 5-minute bouts initially if you can't tolerate a whole lot of it, especially if your leg is numb, then start to progress up a little bit. So you're gonna do a little bit more every day. After the walking, you're gonna lay flat on your stomach. So you can lay here for up to 5 or 10 minutes. Try not to sleep here. It's a lot of cervical spine rotation, but you can lay here for your low back for several minutes and see. And initially it's gonna hurt a little more. Once you feel pretty good, you're gonna just prop up on your elbows and you're gonna relax your glute muscles. Make sure you're not squeezing these, and you're just gonna relax and let that stretch come through. 30 seconds, and then slowly lower back down. And you can do 3 to 5 of those a couple times a day. It really just depends on how you're feeling. The next stretch for disc pain, you'll grab here. You're gonna bring your toe towards you, so not here, but here. And you're gonna straighten up until you feel a hamstring stretch in the back of your leg, all the way through the calf. Now, if you have true disc pain, or if you have shooting pain and irritation, you're gonna get your foot up and you're not gonna go very far before that intensifies. Hold for 5 seconds, and then you're just gonna bend the knee. And then you're gonna do it again. And you're gonna do 10 on each leg. And you would do that once to twice a day, depending on what your tolerance is for the activity. Hopefully, those give you a little bit of relief. If they do, I'd love to hear about it. If they don't, I'd also love to hear about it. So again, you know, see a physical therapist if you're having a lot of trouble. See a physical therapist if you're having a lot of pain and if none of this works. Obviously, this is not medical advice. It's just a recommendation to give you a shot and see what you can do. Walking is one of the most important things when you have pain. I know a lot of times we think pain, we need to rest. That's not always the case. We need to move because our bodies are made to move. Give me a shout out if you need me to help you find a physical therapist. Let me know what's going on with you and let me know if I can answer any more of your questions. Also, let's see what else we can do as far as putting in a comment section what else you would like to hear about. I'd love to hear from you. Is there any other series you would like, anything that would benefit you? All right, I hope you guys have a great day.